Did the Food and Drug Administration report that Pfizer-BioNTech COVID-19 vaccines caused blood clots? No, that's not true. A study conducted in part by the Food and Drug Administration, FDA, identified 4 new statistical signals for modestly elevated risks of certain conditions, including blood clots, for people over 65. However, the study authors specified that the findings are not necessarily causal and may be due to factors potentially unrelated to vaccination. They emphasized that more robust epidemiologic studies are needed. The claim that Pfizer's COVID shot causes blood clots was made in a December 17, 2022, tweet by @HodgeTwins, a stand-up comedy act comprised of twin brothers Keith and Kevin Hodge. Twitter CEO Elon Musk responded to the tweet, amplifying its visibility. The Hodge brothers claimed that the FDA finally came out and said that Pfizer's COVID shot causes blood clots. Screenshots of the tweet with Musk's response were then reshared on Instagram. The posts read, quote, @HodgeTwins, so the FDA finally came out and said that Pfizer's COVID shot causes blood clots? Only 2 years late, @Elon Musk, much will come to light as Fauci loses power. End quote. Here is how the post appeared at the time of writing. Source: Instagram screenshot taken Monday, December 19, 11:09, 08:2022 UTC. This claim appears to have originated in an article published by the Epoch Times on December 17, 2022, that cited a December 1, 2022, study published in the peer-reviewed journal Vaccine. The title of the study is, Surveillance of COVID-19 Vaccine Safety Among Elderly Persons Aged 65 Years and Older. Its researchers represented the FDA, Healthcare Policy Research Center Acumen LLC, Stanford University's Department of Economics and the Centers for Medicare and Medicaid Services, a federal agency that manages publicly funded health care. Citing the study, the Epoch Times reported that Pfizer's COVID-19 vaccine has been linked to blood clotting in older individuals, according to the U.S. Food and Drug Administration, FDA. The article read, in part, quote, FDA researchers, crunching data from a database of elderly persons in the United States, found that pulmonary embolism, blood clotting in the lungs, met the initial threshold for a statistical signal and continued meeting the criteria after a more in-depth evaluation. The FDA said it wasn't taking any action on the results because they don't prove the vaccines cause any of the 4 outcomes, and because the findings are still under investigation and require more robust study. End quote. However, the FDA did not report that the Pfizer-BioNTech COVID vaccine caused, or was even linked to, blood clots. In fact, the authors of the cited study pointed out the lack of evidence for a causal link between the two, writing, quote, the statistical signals of 4 serious outcomes are not necessarily causal and may be due to factors potentially unrelated to vaccination. Additional analyses indicated that the potential association was less than twice the historical rates and may be associated with factors not accounted for in the near real-time surveillance methods. End quote. As part of the study, researchers analyzed the Medicare health insurance data of more than 25 million people 65 and older who had received a COVID vaccine between December 11, 2020, and January 15, 2022. The team identified 4 new, statistical signals, indicators of potential connections not yet established, for modestly elevated risks, that include the development of blood clots. The National Library of Medicine describes statistical signals as a way to detect previously unknown causal associations between medicines and unexpected events. These associations can serve as an early warning system for health problems. The researchers note that such surveillance measures have been used to characterize the safety of the annual influenza vaccine. For the Pfizer-BioNTech COVID vaccine, the researchers detected statistical signals for the following 4 serious outcomes for a restricted group of individuals over 65. Myocardial infarction, AMI, also known as a heart attack. Pulmonary embolism, PE, a blood clot that moves into the lungs from a blood vessel elsewhere. Disseminated intravascular coagulation, DIC, abnormal blood clotting. Idiopathic thrombocytopenic purpura, ITP, low levels of blood platelets, which stop bleeding. The researchers wrote, however, that these findings do not prove that vaccines cause the safety outcomes, nor do they establish a causal association between the outcomes and vaccination. That's because the study looked at medical billing codes for certain conditions among people 65 and older who had received the COVID vaccine.